I am Dr. Ben Gonzalez, and this is Dr. G's Corner. Addiction comes in many forms. There's a general misconception of addiction as a moral rather than a medical problem. As a physician who's taking care of the extremes of addiction, I've come to the understanding that distinguishing the term or the noun addict from the disease addiction goes way beyond semantics or political correctness. This misunderstanding of distinguishing immoral behavior and a medical disease process helps distinguish the misconceptions of how an addiction should be managed and how it should be thought of. I know this is heavy, but in today's world of increased social media and rapid dissemination of information, misconceptions with addictive behavior become false beliefs or dogma. The definition of addiction is the inability to stop consuming a substance or activity even though it is causing physiologic or psychologic harm. This can be a genetic predisposition or a learned process. Whether it is drugs, alcohol, food addictive behavior, or the pathways in the brain, all the pathways in the brain are similar. For example, the brain nerve centers for cocaine or opioid addiction are also the same areas for food addiction. You know, that inability to stop eating salt, sugar, and fats. It's the same nerves that feed cocaine addiction. Sometimes just presenting that knowledge to my patients who struggle with obesity or weight or with food addictive behavior is a relief to them, knowing that this is not a moral or self-control issue. This is a real medical issue, and if it is a real medical issue, then there can be tools to help. Many tools come in the form of medications. Ironically, some of these medications have addictive side effects. People are told the potential side effects outweigh the issues associated with the addiction, and this is usually true in the short run. But what about long-term success? Our patients who want to quit smoking or stop taking prescription pain medications or stop their uncontrolled eating behavior all have similar difficulties of addiction. I've found that a full-spectrum CBD oil can be a powerful tool, not only to help with the addiction, but help heal the damage of the addiction with CBD's antioxidant and nerve healing properties is like that, things that I've talked about in the past, Dr. G Corner Spots. CBD can also help manage the anxiety of addiction directly as well. This is a powerful combination towards improved health. A human study published in 2019 in the American Journal of Psychiatry looked at CBD and found that a single dose of CBD once a day helped alleviate the anxiety of that addiction. And if the anxiety level was decreased, then this allowed for the ability to stop the addiction or the addictive behavior and increase the success for the prevention of relapse. And this works for the extremes of smoking or opioid addiction to the more subtle issues of food addiction, whether it is genetic or not. And this is powerful. So if you have any questions concerning the use of CBD for food addictive behavior, smoking, alcohol, prescription or illicit drug use, or any other medical issue, you can call my clinic at 301-622-2722 to set up a telephone appointment, and I will be happy to answer your questions. That's 301-622-2722. And mention you heard me on this program. You can also direct message me on Instagram as well. Just search Ben Gonzalez, that's one word, BenGonzalez_MD. Well, guys, I hope that helped, and have a good rest of your day.
Yeah, thanks, Doctor. I have one more question for you because we get this often. When someone is in recovery and they're getting drug tested, taking a full-spectrum CBD oil, what sort of advice do you give them?
Yeah, that's a good question. So it does not come up on drug testing. The THC is less than 0.3%, and you'd have to and the key is ensuring that there's a certificate of analysis. You got a high-quality, full-spectrum CBD oil. So, but you'll have to speak to your doctor directly and bring that product to your doctor or someone who understands that before you start taking CBD, especially if you're getting drug testing. I hope that made sense.
It does. Thanks for the advice there.